The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
It is never too early nor too late to work towards being the healthiest you. Very good evening, viewers. Welcome to the 90th episode of BMC Global Live Alhilal Health World, nothing but lifestyle. Myself, your host, Marina Francis. From the time the pandemic has begun, when we see some symptoms of the slightest sickness, maybe a flu or a small fever, it is common that we get very worried about it. And these days, we find that along with rising cases of COVID-19, there are also rising cases of viral fever among people in Bahrain, including the children. It has become a matter of concern. Therefore, in today's episode of Health World, we have taken up the topic viral fever to understand more about it and so to know how to prevent it. We have a very apt person joining with us today to talk to us about the topic, an ENT specialist with over 8 years of experience in the field. It is my pleasure to welcome Dr. Mohammad Ahsan. He has completed his MBBS from Calicut Medical College and MS from SDM College, Karnataka, and he is currently working at Alhilal Hospital, Manama branch. Good evening, doctor.
Good evening.
Welcome to Alhilal Health World. Thank you for joining with us once again.
Thank you.
Doctor, as I mentioned, viral fever has become a rising concern these days. I feel after the schools also have begun and due to the climate change. But I feel that most of us do not have a clear idea on what is viral fever. Doctor, can you elaborate what is viral fever?
Sure. Viral fever as such is a term for usually any temperature rise. We collectively call it as a viral fever.
Okay.
Usually our average body temperature is around 37.1 degrees centigrade or 98.4 Fahrenheit. Okay. So any rise in temperature above that we usually consider as a fever. And in case of viral fever, it is due to the immune mechanism in our body which fights against the viral particles which has entered into our body. It produces certain products like pyrogens. So it will elevate the body temperature to fight against the virus. That's why we have fever. Usually viral fever, it's a acute disease and it may persist for 3 to 5 days or more than that, up to 14 days also. Usually seen common in climate changes, especially during in monsoon as in our tropical areas in our country, or in Bahrain also we have seen lot of viral fevers during summer or in the winter also.
Yes.
And usually it is seen more common in the kids who are going to daycares or children or those persons who are having a low weak immunity also.
Okay.
And viral fever can be different types based on the body organ which is affecting. Usually we see lot of respiratory viral infection which affect our respiratory system. Like we know COVID or the normal flu, seasonal flu, influenza or the respiratory virus, other viruses are there, SARS, MERS, lot of viruses are there which affect our respiratory system.
Okay.
This presents with normal cold and flu symptoms like fever, cold, cough, sore throat, headaches, body pains or something like that.
Okay.
Those are the respiratory viral infections. Then we have other groups also like gastrointestinal viral infection which presents with abdominal pain, diarrhea, vomiting. Those are more commonly seen in kids. Viral diarrheas like it is seen with the rotavirus, norovirus, some adenovirus also. And we have other viral infection like hemorrhagic viral infection. In such cases, viral fever, it's associated with our circulatory system failure. There will be little hemorrhagic problems in the body, like we see in dengue or yellow fever, something like that. Then we have exanthematous viral fevers. Those are seen with viral fever along with skin rashes or eruptions, as we know in about chicken pox, measles, rubella, or the smallpox, something like that. Then coming on to other types, we have nervous system affecting viruses, like we see with fever, convulsions, as such seen in rabies, encephalitis, or the Japanese encephalitis, something like that.
Okay.
These are the basic classification of the viral infections.
Doctor, you have explained in detail what is viral fever. So most of us would have faced different symptoms of viral fever. So can you explain about what all could be the symptoms associated with it?
Yeah, symptoms, it depends on the type of viral infection, as such I told you.
Yes.
And it depends from person to person also.
Okay.
The most common symptoms is usually fever.
Yes.
It could be mild or moderate or high grade. Mild means if it is less than 100 degree Fahrenheit, we call it mild.
Okay.
We call it a high grade fever when it goes up to 103 or 104 Fahrenheit also. Fever is the main symptoms, but it could be associated with other symptoms like headache, body pain. Body pain may be muscle pains or joint pains. In the eyes, we can see redness or burning sensation in the eyes. In the nose, we have nasal congestion or running nose, sore throat, cough, chest discomfort. In the stomach, we can have sometimes nausea, vomiting, diarrhea, abdominal pain also. And sometimes, as I told, we can have skin rashes. We'll have lot of fatigue, tiredness, dizziness. Sometimes, if there is a high fever, there will be chills also. And all those symptoms depend on the type of infection and person to person.
Yes. Okay. So, doctor, what could be the cause of getting a viral fever? We know it is transmitted from person to person. what could be the other causes also?
Most of the time, the viral fever is transmitted by person-to-person contact. As we know, during the COVID pandemic, we know a lot of
Yes.
transmission, and in most of the case, it's transmitted from one person. It could be a host or a carrier. Host means a person infected with virus, those and showing the symptoms also.
Okay.
And there are carriers. Carriers means they have virus inside the body, but they're asymptomatic. But both can transmit the disease.
Okay.
So it could be transmission, close transmission, or from the droplet inhalation of droplets. When they cough or sneeze, the viral particles also they'll transmit also.
Yes.
And then we can transmit if they share food or drinks which are used by the persons who are infected with the virus.
Okay.
In certain cases, the viral transmission can occur with the bite of insects or rodents or mice, as we see in dengue,
Yes.
something like that. And then it is also seen in sometimes with when we come in contact with the body fluids like saliva, blood or something, or after blood transmission we can get some viral infection as seen in AIDS also. These are the main way we transmit the disease.
Okay. Doctor, you mentioned about the types of viral fever. Are there any specific causes for the different types of viral fever? Or?
No, it depends. When all the virus won't affect all the parts of the body.
Yes.
Usually, as we know in COVID, coronavirus usually affects our respiratory tract, like
Yes.
lungs or upper respiratory area.
Yes.
Based on the area which infects only, that we classify.
Okay. Definitely, we have only spoken about some technical aspects of what is viral fever and what are its classification. We need to most importantly know about how to prevent viral fever. We will talk about it, but I'm taking a short break. In this gap, do share this episode to your dear and near ones. Definitely, they'll find it useful. So we'll be back after a short break.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Welcome back. You're watching BMC Global Live Alhilal Health World. Today's episode is on the topic viral fever. With us is Dr. Mohammad Ahsan. So let us continue with the discussion. Doctor, my next query would be, how is a viral fever diagnosed?
Usually the viral fever or any fever, it's based on the clinical assessment. We'll
Yes.
get a detailed history from the patients, like what all they have, how it started. Based on those things only, we clinically diagnose it. And for confirmation, we sometimes may need some blood tests, urine tests, swab tests, or saliva test, or some specific viral antigen or antibody tests also. Basically, we do a blood test like WBC count test. We can come to know what type of infection it is, and we can identify whether it is a viral or bacterial also. But this all could be done initially only, but usually in viral infection, when it stays for more than 3 or 5 days, usually secondary bacterial or other opportunity infection comes. Then we may get mixed up, like bacterial infection or a viral infection.
Okay. Doctor, so once viral fever is diagnosed, how do we proceed with the treatment of viral fever?
Usually that also depends on the symptoms and from person to person. In some case, the same virus can cause severe infection in one person and mild infection in other person also. Based on symptoms only, we treat it. If
Okay.
there is a mild infection, we usually advise a paracetamol or ibuprofen, and I will ask them to take a lot of fluids containing electrolytes and lukewarm baths, such
Okay.
things. That will help the body pains or fever or the dehydration, body aches. That will help in them. But
Okay.
in case if there is a little higher grade fever, we may advise paracetamol on a higher dose. And in some cases, we may need to give intravenous paracetamol also.
Okay.
And in certain conditions, if the person has a low or weak immunity, or there is a chance for secondary bacterial infection, we may start with an antibiotic also. Okay. Most of the time, we need a paracetamol and antihistamine or something like that. That will be enough for them. Usually, it will subside within 3 to 5 days usually.
Doctor, generally when we see the symptoms of viral fever, we tend to stay back at home and self-treat ourselves. That's what most people tend to do. So, in your opinion, when should we actually see a doctor? What would you advise?
Self-treatment is okay, but most of the people over-medicate. Some
True.
people will take more medicines, like unnecessary antibiotics also. You should not self-medicate. Like, you should be knowing little about the medications and their dosage, minimum level you should know. Then only you should self-treat. Otherwise, always you should consult a doctor. In such cases, you have to take proper bed rest, home rest also, and drink lot of fluids, which prevents dehydration, the muscle pains and all. And take paracetamol or Panadol or something tablet like that, along with the painkillers.
Okay.
You can take normally you can take such things. Eat a healthy and nutritious food which is easily digestible.
Okay.
And then always maintain personal hygiene, and you have to add immunity boosters like zinc, honey, or vitamin C in your diet also. And always properly dispose of your tissues which have you use, so that you can prevent the transmission to other persons also. And other things like, do not start with the antibiotic unnecessarily.
Yes.
If you take antibiotics every time when you get a viral fever, you may develop antibiotic resistance also.
Okay.
Then it will be difficult to treat in the actual scenario. So, and if you feel lot of chills, you should not use over blanket or more clothes. That will cause body will get sensitized to that also.
Okay.
And you should not stay in extreme climates like too hot or too cold.
Okay.
It should be a normal room temperature.
Yes. Okay. So, doctor, I think today the most important question is to know how to prevent from getting a viral fever. What is your advice?
After the COVID pandemic, I think everybody will be knowing about the prevention. It's like all personal hygiene. That means always wash your hands with soap and water, and use sanitizer for sanitizing your hands, and avoid touching your face and nose unnecessarily. And eat a warm and healthy food. Don't take normal cold or normal temperature food, because viruses are seen mostly in normal temperature or cold temperature. If you warm your food and eat it, that will be always better.
Okay.
And for the prevention of normal flus, we can get the seasonal flu vaccines are available. You have to take it during before the winter season every year, so that you can prevent a lot of seasonal flus. Especially it is recommended in kids who are going to schools.
Yes. Okay. Doctor, would you like to sum up today's episode as a take-home message for our viewers? What all should we take care regarding viral fever?
Personal hygiene is the main thing. You have to be cautious when you had a fever, or when you get a fever. You have to take proper rest and maintain your personal hygiene. Wear a mask, wash your hands, sanitize, and stay healthy. You should not transmit to others and let them get the disease.
True. I think after the pandemic has begun, we
Most
have
of us
developed
know,
some
yeah.
hygienic
Yeah,
practices.
definitely.
We need to continue that, I
Sure,
feel.
sure.
Thank you very much, doctor, for answering to all our queries and joining with us today.
Thank you.
I hope that definitely this episode was very relevant for all of us, and I hope you found it useful as well. So stay tuned every Tuesday 8 p.m. We will be back with such informative topics. Until then, this is Marina Francis signing off. Stay happy, spread happiness. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.